Well, welcome to the webinar, everyone. Another Wednesday, another Lunch and Learn. Mark Bennett on behalf of IDLife. Glad you've joined us today. Today's topic is going to be an interesting one. It's one that affects everybody. And what I mean by it affects everyone is even if it doesn't affect you personally, it has affected someone in your family, somebody that you care about, somebody that you love, or somebody that is very close to you. It's something that we should all learn more about. Unfortunately, it's something that we have a tendency to react to as opposed to prevent. But that's what today's about. It's all about giving you the information so that you can start taking some preventative measures, so that you can start taking control of your health and avoid heart disease. So let's jump in. First and foremost is we are at an evolutionary shift, if you will, in medical science and its approach to heart disease. In fact, one of the biggest pushes right now in medical science is to try to find a way to eliminate heart disease altogether. Is that even a possibility? And what today is going to show you is that we are getting closer and closer to finding the answer to that. It just may surprise you what that answer is. First thing you need to know. This is the statement that you'll hear everywhere. This is the statement that you can Google, you can find anywhere on the internet. The number one killer of Americans is heart disease. Hands down, kills more people than anyone else. Or is it? Is it really heart disease? Is heart disease really the number one killer? The reality is it really isn't. The number one killer in America is our wonderful hand-to-mouth disease. Our hand finding our mouth way too often with the wrong thing that results in heart disease, diabetes, metabolic syndrome, and all the other issues that we deal with from a chronic disease standpoint. But hands down, the number one killer in this country is hand-to-mouth disease. We are eating ourselves to death, and that's kind of what we're going to go through today. Because one of the leading contributors to heart disease is obesity. It is one of the things that is leading the way. It is one of the things that puts us in the greatest risk factors. It's one of those things that is controllable simply by us making better choices. But, we have habits, we have addictions, we have cravings, we have all of these things. And sometimes it's easier to just live life, so to speak, as opposed to actually planning your life and understanding that there's an easier, better way. But, we have to understand the facts. We have to understand the downsides. And part of what these Wednesday Lunch and Learns are about is to give you the information to make informed choices. And you may continue down the same path that you're currently on. You may choose that, Mark, I hear what you're saying. It's just until something happens to me, I'm just not going to do anything about it. I pray that today gives you a different mindset, that you don't think that way, that you're not thinking, I'm going to wait till something happens and do something about it. And you're going to see why very soon. Here's what the numbers look like right now. Obviously, the South is the leader when it comes to heart disease in this country. This is for ages 35 and above. This is CDC data from 2008 to 2010. So the data is actually a lot worse now than what this even shows. But I wanted to show everyone kind of a demographic type of survey map where you could actually see where the heart disease is concentrated in this country. And when you look at, Texas in the east side of things, Oklahoma, Louisiana, Arkansas, Mississippi, Alabama, even parts of Florida and Tennessee, it gets bad. It is really, really bad. And we've got to do something about it. We really do. So let's look at some of the things that contribute to it. We're talking about heart disease, so why would we bring up diabetes? These are the numbers, 100 plus million. 28% don't even know they have it. Childhood obesity through the roof, so much so that we don't even call it adult onset diabetes anymore. We just call it type 2. Here's the reason why we're talking about diabetes. 68% of diabetics will die from heart disease or stroke. That's right. So if you have diabetes, if you currently have recently got diagnosed with type 2, just realize 68% of the people that have diabetes will die from heart disease. It's one of the things that just leads down the path. It's almost like the body's warning system of, look, I'm going to give you diabetes so that you can change your diet. So hopefully you can do something about it before I give you the real thing that you can't do anything about, which is, the heart attack that you don't recover from. It literally is us not listening to our body. Our bodies are trying to tell us this is where we're headed. But know that if you have diabetes, heart disease is on the horizon. Here's another issue that we're dealing with. Our average intake right now is over 2,500 calories in this country. Look at our snacks. Our snacks are over 580 calories for men, over 420 calories for women. We are literally eating ourselves out of existence. That's what we're doing. But our snacking problem is a big issue. Our calorie count, the number of calories that we're consuming, mainly the ones that we're drinking, are directly leading to the heart disease issue that we have in this country. On top of that, we don't have a lot of muscle anymore. We just love our fat, apparently, because right now the average man is hovering somewhere around 28% body fat percentage. Healthy is between 10 and 22. Women is at 40%. Healthy is between 20 and 32. We just are not a very muscle-prone society. It's a leading contributor to our issue. And then, of course, we have the big one. 74% of us are overweight. We are walking around every single day with excess belly fat, visceral fat, and other types of fat on our body that is unneeded, unnecessary, that's directly linked to the diet that we choose and the choices that we make every single day. But these are contributors to the issue that is in what we call heart disease. So let's talk about that first heart attack. A lot of people have the mindset of, well, you know what, I know it happens to other people. I know it's in my family history. I know it's something I should be concerned about, but I'll be concerned about it when I need to be concerned about it. I'll do something about it when I need to do something about it. That is the wrong mindset, and we're about to talk about why. See, because heart disease by the numbers, if you actually look at the numbers of what heart disease does and how it affects people, this is, the average 10 people, if you will. This is how it breaks out. You roughly have 30% of people that will never have a heart-related disease issue in their lifetime. Congratulations to that 30%. Those are people that are genetically blessed, have chosen a good lifestyle, have great habits, or whatever the case may be. Or it may just be that they died at a young age and never had an opportunity for heart disease to develop. There's any number of things that could contribute to this, but 30% of the population simply does not have and will not have heart-related disease in their lifetime. Then you have 30% of the population that have heart disease and will have heart disease, but they will die from something else. Their heart disease won't be what kills them. The heart disease will basically affect their life, but it will not be something that they die from. Then you have 30% of the population that will have heart disease. They will have a heart attack. They'll get a second chance at life, but they'll die from the heart disease anyway. These are the people that got the second chance but didn't listen to the body, went back to their old habits, and sure enough ended up dying from it anyway. That's the other 30% of the population. And then there's the 10%. And this is the percent of people that had that mindset of, I'll just wait till something happens and I'll do something about it. That 10% discovered they had a heart disease or discovered they had heart disease on the day they died. That's the heart attack, which was the first sign that they had heart disease, where they keeled over and they never got a chance to do something about it. If you are that type of person, if you have the mindset of, I'll do something about it when it happens, think about this 10%. Think about the people that don't get the second chance. Think about the fact that you may be one of that 10%. Why take that chance? Do something about it now. Go to the doctor. Find out what's going on with your numbers. Watch the warning signs. Find out what's going on with your body. So let's look at the facts and figures. How big of a problem is it? Is it really this big of a deal? I mean, it's the number one killer in America, so it's got to be something. 1 out of every 3 deaths in America is related to heart disease. 1 out of every 3. 33% of them are all related to heart disease. Every 28 seconds, someone has a heart attack in this country. Let that sit in for a second. Every 28 seconds. So from the time that we started this presentation about 9 minutes ago, you have, what, roughly 18 people have had a heart attack. Hopefully not because of what I've said on this presentation, but in all seriousness, I mean, that is how serious the problem is. So what does that really mean in numbers? That means over 1 million heart attacks a year are occurring in this country, or over 3,000 per day. Here's the thing that should get your attention. 40% of those are fatal. Of the over 3,000 that happen a day, 40% of the heart attacks are fatal. In other words, people don't get to see the next day. Every 33 seconds, someone dies from heart disease. That's right. So people are having heart attacks every 28 seconds, and every 33 seconds, someone's dying from heart disease. So maybe they didn't die from the heart attack, but they did die from the disease itself. That's over 2,600 people per day that are dying in this country because of heart disease. That's over 955,000 deaths per year related to this issue. Here's the number that you should pay attention to, though. The National Institute of Health contributes 500,000 of the 955,000 deaths directly to poor diet. That's right. More than half of the heart disease deaths that occur every year are directly linked to a poor diet. That's it. People making poor choices that lead to their own death. Things that could have been avoided, things that they could have done differently, but they didn't. Currently, there are over 27 million cases of obesity-induced heart disease in the United States. That's the number so far. So you have 27 million people, just under 8% of the population in the U.S., that have obesity-induced heart disease. This is not genetic. This is not something that they were had a predisposed condition in order to get there. This is not something that they were preordained to have. This is something that their hand-to-mouth disease induced. They literally ate themselves into a heart disease situation. And currently there's over 27 million people in the U.S. that have that issue. Heart disease costs the United States economy a little over $108.9 billion per year. This is all the cost associated with it. But I mean, $108.9 billion is the cost of this disease. And the unfortunate part about it is a majority of it is avoidable. Things that we can do something about. And granted, there are some people that are genetically predisposed. There are certain people that just got the bad, raw end of the stick, so to speak. But the issue is a lot of this can be avoided. So right now you're probably feeling like this. You're probably feeling like, wow, these numbers it's an eye-opening. You hear them all the time. You see them all the time. But if you're taking the time to watch this webinar, I'm hoping that you're having this type of reaction, that this is a bigger problem than what you've heard. It is something that affects you. And when I say you, I mean every single one of you that is watching this is affected by this in some way, something that you can do something about. And this is the effect. But the reality is, I want to even get deeper. See, because when you actually look at the demographic numbers, they're alarming. So what do I mean by the demographic numbers? What kind of specifics am I talking about? Let's start out with women. Heart disease is the number one killer of women, more than all cancers, respiratory diseases, and Alzheimer's diseases combined. 90% of women have at least one risk factor for heart disease right now. So 9 out of the 10 women that are watching this webinar right now have a risk factor for heart disease. 64% will die from heart disease. Women that die from heart disease had no prior symptoms. That's right. 64% of the women that die from heart disease had no idea that it was coming. So all of the women listening, all the men that have women in their lives that they care about, so hopefully I've now touched 100% of people, realize if they have that mindset of I'll wait until something happens, 64% of women don't get a second chance. It literally takes them out. It literally kills them, and they had no prior symptoms. Here's the other thing. 1 in 4 women die within 1 year of their first heart attack. What that basically means is 25% of women die within 1 year of having the heart attack that they survived. Now that's contributed to a lot of different things, but a lot of it is diet choices, just going back to the same diet that they had that got them to the heart attack in the first place. But there's other risk factors and other things that contribute to that. But know that 25% do die within the first year. But the biggest issue is this. We lose a woman in this country every minute. Every minute a woman dies of heart disease. That's a staggering number. And so ladies, take note. This is where we are with heart disease and you. Let's talk about African Americans because there's some numbers here that are pretty dang scary. African Americans are 2 times more likely to die from heart disease than white Americans. And 49% of African American women, 44% of men suffer daily with heart disease. That's compared to 32% of white women and 37% of white men. The numbers are bad. But here's the biggest thing. African American women and men suffer the highest prevalence of high blood pressure in the world. This isn't just, America now. We're talking about in the world. African American women and men suffer the highest prevalence of high blood pressure in the world. African Americans are 77% more likely to be diagnosed with diabetes than white Americans. That's 77%. Remember, 68% of the people that are diagnosed with diabetes are going to die of heart disease and stroke. So we have to do something, and we have to understand these numbers. We have to understand that we don't get the opportunity to wait. But one of the biggest risk factors, one of the biggest leading contributors to this is this last stat. The obesity rates are a big part of the disparity. 80% of African American women, 78% of Hispanic American women, and 60% of white American women are overweight. You can see the disparity. You can see why the numbers are what they are. You can see why it's so skewed against the African Americans in this country. The numbers are staggering because a lot of it has to do with our diet, things that we're choosing to eat, drink, and put into our bodies. This is a leading contributor. This is something that we have to do something about. But the main thing is, look, if you are not paying attention to your blood pressure, if you are not getting regular checkups, if you are not getting your annual physicals, take the time to make it happen. Blood pressure, high blood pressure is the first warning sign of a bigger issue, of a bigger problem. Take the time to find out. And if you have that, let's implement some of the things we're going to talk about today and prevent us getting to the other stages of problems. Let's look at Hispanic Americans. Hispanic Americans, 1 in 3 have heart disease. 1 in 3, as we said here today, have heart disease that they're dealing with every day. Causes more death than all cancers combined. 66% more likely to be diagnosed with diabetes than white Americans. Hispanic Americans at age 20 and older, 75% of the men and 78% of the women are overweight. Let that set in for just a second. Hispanic Americans age 20 and older. This isn't people that are in their 50s and 60s. This isn't people that have, started to slow down and the metabolism is going. This is people 20 and older. 75% of the men and 78% of the women are overweight. But here's the biggest one. Hispanic ladies, pay attention to this one closely. Hispanic women develop heart disease 10 years earlier than their white counterparts. That's right, 10 years earlier. The life expectancy is way down compared to the white counterparts. This is something that is part of what we eat on a regular basis. This is part of our culture. This is part of what's going on with regard to the choices that we're making on what we're putting in our mouths, what we're drinking, and what we are exposing ourselves to. But these numbers should be enlightening because the best part about it, most of these issues, most of the things that you see here, most of the things with regard to diabetes and obesity, and those are things we can avoid. Those are things that we can do something about. So let's know the numbers. Asian Americans, let's look at their numbers. 7% have heart disease. That's right, this isn't a misprint, 7%. But it still causes more death than all cancer combined. 11% are overweight or obese. But yet, even with only a 7% heart disease rate, 11% overweight rate, they're still 18% more likely to be diagnosed with diabetes than white Americans. Now, what's funny about this is the average Asian diet has a large amount of carbohydrates. So I know you've seen all kinds of crazed and all kinds of funny diets out there with regard to carbohydrates are evil and things of that nature. Avoid, this, that, or the other. But the idea is, in this particular culture, carbohydrates are king. They make up almost 50% of the food that is consumed. So make sure that you understand that. But the issue here is this. Even Asian Americans have something that they need to be concerned about, something that they need to watch out for. So even though a lot of them are thinner, because you only have 7% or 11% that are overweight, you still have a high prevalence of heart disease, and you have a real chance of being diagnosed with diabetes, which obviously we now know contributes directly to that heart disease. Let's talk about this one. because when we talk about demographic numbers, this is one that I don't think gets enough airplay. I don't think that we've heard enough about it. If we hear a tragic story that affects us or someone in our community or someone in and around our area, then by all means, we all of a sudden we pay attention to this. But this is a much bigger issue than we think, and we need to understand the numbers behind it. Sudden cardiac arrest is the leading cause of death in young athletes. That's right, it is the leading cause of death in young athletes. A sudden cardiac death occurs in young athletes every 3 days in this country. So see, you've heard it on the news, and you hear it about once a month or once every other month or a couple of times a year, but this is happening every 3 days in the U.S. 90% of these athlete deaths are male. Most of it's related to basketball and football players. Don't really know why that's the case, but that's where a lot of that comes from. More than 52% of these deaths are African American young men. That's right. More than 52% of these deaths that are occurring every 3 days are African American. And the average age when this occurs is 17 and a half. In the prime of life, our young teenagers, getting ready to start their lives, getting ready to go off to college and do whatever it is, they had planned in their future, they die suddenly of a heart-related issue. Let's get checked, guys. Let's actually have our children, checked. These are things that could be avoided. We just have to go through regular checkups. We have to have, the procedures done. We have to make sure that if our kids are going to engage in sports, that they've been thoroughly tested. And I can tell you, a lot of times, these annual physicals aren't enough to catch it. Unfortunately, they just aren't. We have to take control of this, and we have to ask for the things that we want, and we need to turn this number. I mean, the fact that we're losing young athletes every 3 days to sudden cardiac arrest is inexcusable. There's something that has to be done about it, and it starts with you having the information and the knowledge base that it exists, that this is a problem, and that we need to do something about it. So let's look at the traditional cardiac management protocol. Okay, so you have now gone to your doctor, you've been diagnosed with heart disease, and this is what we're going to go through. And this is the way it typically works. We're going to start with some form of cardiac rehabilitation. That could be in the form of getting you a personal trainer, it can be physical therapy, it can be any number of things, but the idea is we're going to get your body moving. There's going to be a recommendation of a lifestyle change, and we're going to talk about whether or not the change that is being recommended is the right change. There's prescriptions involved, as we all know. And if that doesn't work, then we go to the implanted devices. There's all kinds of them now, but implanted devices is obviously another step in the management protocol. And then, of course, if all else fails, we can always go into surgery. All of this, not a single bit of this, is related to reversal of heart disease. All of this is management or putting a Band-Aid on the heart. See, most people don't understand or appreciate that the medical approach to heart disease is nothing more than managing the disease. It is literally just trying to triage the issue. It's not getting to the root cause. It has nothing to do with reversal. None of this is going to fix the problem. That's right. None of this is going to fix the problem. It is going to triage the issue. It is going to extend life. It is not going to help you reverse the problem that you find yourself in. We're not getting to the root cause. Let's look at some of the prescriptions. The number one prescription that you're going to see when somebody has heart disease is a statin drug. It's a preventative. You have high cholesterol. We got to do something about it. Statins, are where people go. This, in fact, won the Nobel Prize of medicine. When these things were discovered, all kinds of things. But what are the details of statins? What do they do to us? What are they, and how prevalent are they? Well, 1 in 4 Americans is taking a statin drug right now. That's right. So you have 64% roughly of the population that is basically has some heart-related issue or problem that they're dealing with on a regular basis. But 1 in 4 Americans, 25% of the population, roughly 75 million people, are taking a statin drug every single day in the U.S. So let's look at the numbers a little bit. The common side effects. Well, the common side effects are muscle pain, headaches, nosebleeds, clouded or thinking or what we call mental fog, increased blood sugar, so it can actually cause type 2 diabetes. And these are common side effects, not the less common, but can cause type 2 diabetes, as well as sore throat. The less common side effects, digestive problems, sleep disturbances, dizziness, liver damage, inflammation of the pancreas, itchy red eyes, physical weakness, blurred vision and other disturbances, bruising and bleeding, and yellowing of the skin and eyes. These are the side effects of this. So if you had a choice between changing your diet or taking a drug where you could suffer any one or a combination of these side effects, which one would you choose? Well, every single day, we have 25% of the U.S. population choosing the drug over the diet. That's right. That's where they find themselves. Now, am I saying that, the diet will prevent the drug? No, what I'm saying is if you're on the drug, you should be looking at the diet in hopes that the diet change can get you off of the drug. That's the idea here. The whole concept is if there's something I can do that gets me off of this drug that avoids these side effects, then by all means, why wouldn't I do it? Why wouldn't I focus on it? Why wouldn't I train my body? Why wouldn't I, overcome my cravings and all of my desires and all these things with regard to food? And why do I keep looking at food as a pleasure center as opposed to a fuel source? The idea is we're sick. We got to do something about it. When we're sick, we're more than willing to take a drug, but we're not willing to change the diet, which is still asinine, in my personal opinion. But let's look at this. For every 100 people that is prescribed a statin drug, how many heart attacks do you think are prevented? So for every 100 people that are prescribed a statin drug, how many heart attacks do you think are prevented? And this comes from the expert review of clinical pharmacology. The answer? 1. That's right, 1. For every 100 people that is prescribed a statin drug, 1 heart attack is prevented. Now, the whole idea behind the statin drug, the whole idea about the cholesterol-related issue is to try and prevent the heart attack from occurring, because obviously you have all the warning signs of about to have a heart attack. But if only 1 person out of 100 is actually avoiding the heart attack, does the drug really work? Is it really preventing what it is we need to do? Are there better options? Is there something else that we should look at? Obviously, a 1% success rate isn't very much something to be touted. The other thing that we know for a fact is that statin drugs do 2 things, without a doubt. First, with regard to vitamin K2 in our body, it reduces the effectiveness of the vitamin K2. That nutrient is critical to protect against calcification in coronary arteries. So a lot of the foods that we eat have vitamin K2 in it. And that vitamin that's in our body, based upon what we're consuming, is critical in the protection against calcification of the coronary arteries. If you are on a statin drug, you need to be supplementing with vitamin K2 because of this one issue. You need to make sure that you're reading all the warnings and other things that are in the prescription packet that you get that actually talk about this issue, so that you know that you should be supplementing with a vitamin K2 supplement if you are in fact on a statin drug. As for CoQ10, it depletes the body of the vitamin CoQ10, completely depletes it, and it is the nutrient necessary to protect the heart and muscle. It is literally the thing that protects the heart muscle from muscle failure. So you may very well be taking the statin to stop the heart attack, but you very well may cause heart failure in the process because you weren't supplementing with CoQ10. So the whole idea behind this is to educate you that one of those 17 pages of information that you got when you got your statin prescription talk about the reduced effectiveness of vitamin K2 in the body as well as the depletion of vitamin CoQ10. You need to be supplementing with K2 and CoQ10 if you're on a statin drug. So just know that moving forward. We were moving along and we had this normal protocol, and then we had this doctor from Harvard that came along and decided that he was going to do a study. And if you're not familiar with Dr. Dean Ornish, you should read one of his 6 books. He has now published numerous books, articles, medical journal review articles, all kinds of things on this particular issue. But Dr. Dean Ornish came along and did a study, and I want to talk about it. Because, see, he had 2 groups. Now, there was only 47 patients in the initial groups, but he had 2 groups. He had the control group that received the customary standard of care prescribed at the time for heart disease. That was a diet centered on lean meat, and lean is in quotes, poultry and fish, along with various medications, so the prescription drugs, the statins and other things, and the usual advice not to smoke. So that was the control group. They got the typical protocol. They got the typical cardiovascular treatment medical protocol that we talked about earlier. And then you had a test group. Test group got a little bit different prescription. They got a low-fat vegetarian diet. That's right, plant-based diet. Brisk walking for half an hour a day or an hour 3 times a week. No smoking and stress management exercises. So they did this for a year. They wanted to find out what happens if you do this for a year. Small group study, what happened? Well, the study findings were simple. The control group got worse after a year. That's right. The arterial walls continued their closing. You still had chest pains. You still had all the heart disease risk factors continuing to go up, including blood pressure, etc. Basically, the traditional medical protocol, treatment protocol that had been prescribed for years and years and years did exactly what it had always done, which is absolutely nothing. It basically put a Band-Aid on the issue and basically was prolonging life, but wasn't necessarily addressing the issue. But what happened with the test group? Well, the test group had a much different outcome. The chest pain disappeared within weeks. The cholesterol levels dropped dramatically. Coronary arteries, which had gradually been closing off, actually started to open, and the angiogram showed clear evidence of reopening in 80% of patients. That's right. By simply getting somebody to start moving, in other words, walking. Again, I didn't say go join a gym and lift hefty things above your head. No, these were people that were walking, 30 minutes a day briskly, or, 1 hour 3 times a week. That's all it was. And eating a plant-based diet and, working on their stress levels and not smoking. What ended up happening was an amazing turnaround. It was eye-opening. There was, however, one side effect. And it was a major side effect that has to be reported as part of what happened in the test group. So the control group had no side effects. I mean, they basically just had the same side effects that people go through the medical protocol. But the side effect reported by the test group was pretty astounding. The average patient lost 22 pounds in that year. That's right, by simply getting active, getting to walk again, moving their body, eating a plant-based diet, watching their stress, and not smoking, they literally lost 22 pounds on average. Some lost more, some lost a little bit less, but the average was 22 pounds in that 1 year, simply by following this new protocol of diet versus drug. And what ended up happening was they were reversing the signs of heart disease, and at the same time, they were getting themselves healthy in the process. Then came along Dr. Greger. Dr. Greger wrote a book, How Not to Die. Now, I will tell you, to me, this is a must-read. And anyone that has ever had a heart-related issue that I am close to knows what this book is, because I've given it to you to read, and I will continue to do so. You have to understand, I'm born and raised in Texas. I was always a meat eater. It's just who I am. But Dr. Greger had a life story mainly related to his grandmother that I'm not going to spoil it for you in the book. But the idea behind it was he went down the same path of Dr. Ornish to determine whether or not a plant-based diet could actually help with heart disease. And what his book shows, where there's over 30,000 medical references, studies, and other things in there, the only thing scientifically proven to reverse heart disease, and I want to make sure that you heard this right, the only thing scientifically proven to reverse heart disease, in other words, take you from a state of sickness to a state of health, is a plant-based diet. His book talks about all of this. It basically shows study after study after study where this has been proven. He builds on what Dr. Ornish has done and spends, basically his life work. And in fact, there's actually a website that you can go to that is not paid for or advertised by anyone. So it's all just a legitimate, fact-based information. It's the nutritionfacts.org site. If you've never been there, I highly encourage you to go there and get some of the information. But Dr. Greger, has kind of his wonderful daily dozen, if you will. And the daily dozen is all related around a plant-based diet, but it's the things that basically get you to a healthier lifestyle. It's the things that based upon all of the studies and everything else, have shown to reverse heart disease. It's, servings of beans and berries and fruits and cruciferous vegetables and other forms of greens and other vegetables and flax seeds and nuts and spices and whole grains and beverages and exercise. All of these daily dozen lead to a reversal of the disease. So, if you have a family history of heart disease, I mean, if that's something that is in your family history, you might want to consider picking up this book and reading it so that you can learn how diet can actually prevent that from happening. I've always said that a lot of people use their family history as the excuse, when in reality it should be the motivation. See, so many people, they have a family history of something, so they just think that they're preordained to have what their parents had. But the reality is this: if you do what your parents did and you ate what your parents ate, then you're going to get what your parents got. But if you do things differently, you eat things differently, and you treat your body differently, guess what? Your outcome may be different. So don't treat your medical history as the excuse or the reason why you have something. Use it as your crystal ball. If you don't do something about it, what's going to happen to you? Look at it a little bit differently and see how that changes you. So this is where we are in this country. I know the picture isn't pleasing, but this is, the average American now. This is where we're headed. This is who we are. This is what we're dealing with on a daily basis. And it leads to this. The next exit is heart disease. You may not have it yet. You may not be suffering from it, but the reality is you very well are on the road for it. And your exit is coming. And if you don't do something about it, you're going to have this thing. And once you have it, there's only one way to fix it. So what happens when you get that diagnosis? What happens when you're sitting in the chair and you've heard the webinar, or you basically haven't heard the webinar, and this news is all news to you, and you've already been sitting in this chair and you got the diagnosis? Well, you have a couple of choices. Option A, the typical cardiac management protocol. This is what you're going to go through. You're going to start out with some form of rehab and lifestyle change. You're potentially going to get some prescriptions in the beginning. You're eventually going to lead your way into an implanted device, or completely skip that process and go directly to surgery. But the idea behind it is we're putting a Band-Aid on the heart. We're not actually approaching or getting after the issue. The reality is we have to choose option B. Option B is we're going to move our body. We're actually going to walk. Or, it's not about, lifting heavy things above your head. Like I said, it's all about just moving again. And of course, a plant-based diet. It's actually eating our fruits and vegetables like our grandmother told us to do, and like we used to do when we were, a little bit smarter about our health and we were a little bit thinner in this country. But those are your two options. This is how diet directly affects heart disease. Not only can it prevent it, it can reverse it. And I want to make sure that everyone catches that on this program today. I want to make sure everyone understands the proper diet can help prevent heart disease, but it can also reverse heart disease as long as we follow the protocols and do what's necessary. It's not difficult. I'm not saying it's easy, because a lot of us have strong addictions to food, especially processed foods, things that come in bags, boxes, jars, and cans, and bags through windows into our car. We have these strong addictions that we're having to overcome. But the reality is this: it's life or death. It literally is for a large portion of the population. It is life or death. So you can either eat yourself to death or you can eat your way to health. It's your choice. But at least now you're informed. We always talk about this particular slide of healthy living is diet, lifestyle, and nutrition. Those are the three components to a healthy living aspect of things. But you know what? It all starts with diet. It really does. The reason why the diet is in the lower left-hand corner of this visual is because everything starts there. What we put in our mouth, the diet choices that we're making, and the lifestyle choices that we're making lead to the nutritional gaps that require supplementation in the first place. So if we make better diet choices, if we make better lifestyle choices, then the nutritional gaps are much smaller and we need to supplement less. Just, when you're dealing with heart disease related issues, hopefully what you've seen today is diet is the main key. That is the thing that we have to focus on. You want to learn more about what's going on at IDLife? I encourage you to tune in on Monday nights at 8:30 Central Time. Same place, same time. Everything's the same. Our CEO does a Facebook Live event every Monday night at 8:30. I encourage you to participate in that and get people on that you care about and learn some more about what IDLife is and what it's about. If you want to see some people that have kind of followed the programs, taken the Wednesday Lunch and Learns and implemented them, or more importantly, just taken the IDLife experience and followed the program for a month, go to myidlifestory.com and see how people have really focused on the 6 inches between their ears, not the 40 inches around their waist, and had some dramatic results as a result of just following a very simple program that basically takes less than 3 minutes a day. Want to participate? We have an upcoming competition. We already have our one big ultimate IDLife experience contest coming to an end very soon in May. And then we have another one starting in mid-June. I encourage you to get enrolled. Go to myidlifestory.com to get more information on that. But we're giving away a lot of cash to men, women, and teams. And I highly encourage you to get your teams together, or just submit yourself. Have your support group. Get to know the things that you need to know so that you can make better choices, so that you can make a permanent change in your life, not some temporary weight loss goal thing. If you want to join us in Vegas, we'd love to have you there. We call it Live It Up Las Vegas. We're going to be there September 15th through the 17th. The speaker cadre is going to be great. The training is going to be amazing. And of course, the city is all lights. It always is. So, worst thing happens is you get to spend a weekend in Vegas. The best thing happens is you learn something about health and wellness, and you go home with a vision of what your health and wellness could look like. So join us at Planet Hollywood between September 15th and 17th. Next week, same time, same location, 11:30 Central Time, June 7th, we're going to start talking about understanding marketing myths behind food. What we're going to tackle is the issue that so many Americans struggle with, which is they listen or pay attention to what's on the front of the bag, box, jar, or can, but they don't understand how to read the thing that's on the back that we call the nutritional facts panel. And those marketing myths, things that we believe, things that we see, and things that we buy based upon, sometimes are what contributes to us making mistakes that were intended by the marketing teams that started with them in the first place. So next week is all about trying to highlight for you some things that marketing teams use in the sale of food to get you to buy their products, when in fact they have very little true nutritional value, but you think that you're making the right choice based upon what you see. So tune in next week, same time, same place. Again, on behalf of IDLife, this is Mark Bennett. Until next time, I look forward to talking to you again. Thanks.